I'm Mark, I'm the founder of Konnektis, which is focused on enabling better care outcomes for older people living in their own homes. And we're doing that by creating a hub that stays permanently in the older person's home, that's used by all the different carers that look after them, so people can have access to the right information in the right format at the right time. A vision for this is really important, and our story really starts with my grandfather and my family's personal experiences caring for him. So my grandfather was in his late 80s. He suffered from a whole range of chronic conditions, including dementia, but he lived on his own and he wanted to stay independent. And over time, there was a whole network of people that were helping to take care of him day to day. And a big challenge for us and for him was that a lot of that communication took place on paper. So people just didn't have access to the right information that they needed. So we think that technology can play a role in enabling better communication if you develop it with users, which is what we're focused on. So we're now working with the DHEZ in Bradford, and that's really key for us because there's a real move in Bradford towards integrated health and social care. That's really key because it builds upon the work that we've done in Kent over the past 9 months to develop a system with users, particularly with professional carers. There seems to be a real appetite in Bradford for actually implementing these technologies and scaling them. So we're working with the DHEZ in Bradford to help us to scale Konnektis. We've spent a lot of time with users in various parts of the country, including Kent, to co-design a solution that works for people, particularly professional carers. But what we found in Bradford is a real appetite for integrated health and social care. So the DHEZ have been really very proactive in introducing us to people that can help, including the local council. So we're going to be running a pilot of Konnektis within their reablement service over the coming weeks. And that's really exciting because it allows us to actually demonstrate what the impact of Konnektis is and how it can improve care outcomes for older people. I think the really important thing about any building is the people that are in it. And the thing that I am finding in Bradford is that the DHEZ and their partners such as BT are being really, really proactive in giving us a lot of support so that we can find partnerships to pilot Konnektis and actually develop the relationships to be able to test it, prove that it works, and to scale it. So it's obviously a fantastic building. We spend a lot of time here because we tend to be in Bradford sort of 1 or 2 days a week, and we'll be here a lot more. But for us, it's really about the people in the building. I think it's the most important thing. My visits to Bradford tend to be a combination of packing in as many meetings as possible, particularly with the council that's going to be piloting Konnektis, but also having a space that I can do the day-to-day work that sort of one needs to do. So my time in Bradford tends to be a combination of really packing in as many meetings as we can with the people that are being really enthusiastic advocates for what we're doing in the council. But it's really important as well to have a place that me and the rest of the team can work. And we find the space here really good for sort of co-working and sort of being able to have the space, the time, the sort of internet connectivity and sort of everything else that sort of allows us to do our jobs when we're here.